All right. Again, thanks to all of you for your patience these last few minutes while we had a little bit of technical difficulty. That was a first-time experience. So on behalf of the 2016 training course in MCH Epidemiology, I want to welcome you. My name is Maureen Fitzgerald. I'm the Senior Coordinator for Program and Logistics at CityMatCH, and for the past 4 years, I've had the privilege of working with the National Training Course in MCH Epidemiology. Earlier this summer in San Diego, you participants had a very intense week of on-site training, and now we're inviting you back to join us in the first of 4 monthly post-course webinars. Today's is an introduction to economic evaluation, led by Dr. Kristina Rabarison. I want you to know that this introduction has 3 learning objectives, which are to 1, describe economics and economic evaluation. 2, understand the value of economic evaluation as it applies to public health, and to identify types of economic evaluation. Our presenter, Dr. Kristina Rabarison, is a health systems researcher in the CDC's Division of Population Health, located at the National Center for Chronic Disease Prevention and Health Promotion. She leads studies on the organization, financing, and delivery of population-based services for the Prevention Research Centers, PRC, workplace health promotion, and healthy aging programs. She's a CDC Stephen M. Tuch Prevention Effectiveness Fellowship graduate. Rabarison earned her doctorate in public health, health management, and policy from the University of Kentucky. She has an MS in biomedical sciences from the University of Mississippi Medical Center. Some housekeeping tasks before we begin. First of all, I'm going to ask you to hold your questions to the end. However, please note that down in the corner you will have the ability to, you can write questions in the chat feature, and we can use those when we start the question and answer. So the webinar, as you've noticed, has begun with all the phone lines muted, including our presenter. So to unmute your phones, including our presenter, you'll press the *7 button on your own individual phone. And when you're done asking a question or when you're done presenting, press *6 to remute your phone. And so if there's a time that our presenter wants us to unmute all of the lines for an open conversation, I'll give you a heads up. And there's a reason for that. So, but first of all, do not place the webinar on hold at any time. If you have to step out, please keep the phone muted or disconnect your phone line and call back in. Because if we were to unmute the phone lines, then all of a sudden hold music and all kinds of things comes through, and it can be very distracting and literally bring a call to a halt. We will record this webinar, and it will be archived so that you and other participants who are unable to join us can tap into today's learning. And we will send you an email when that is available for viewing. It will be sometime down the road. And if for some reason you're disconnected from the call or any portion, feel free to call right back in and rejoin. And at this time, I'd like to welcome Dr. Kristina Rabarison to open the webinar, and go ahead and unmute your phone, Dr. Rabarison. Welcome. Thank you so much.
Thank you, Maureen, and hello, everybody. Thank you so much for having me here today, and I'm excited, and it's a pleasure to share with you a little bit about economic evaluation. As Maureen mentioned, I'm a health systems researcher in the Division of Population Health here at CDC, and you can just call me Kristina. I'm not really quite used to Dr. Rabarison yet, even though it's been 3 years now, but I'm Kristina. Before we begin, Maureen, do you mind moving the slide? Before we begin, I'd like to acknowledge my team lead, Connie Bish. She's in the Division of Population Health as well, and she's been tremendous in helping putting this webinar together. She's a MCH epidemiologist by training, so she helped me put the economic evaluation concepts into things that might be aligned with your interest. Next slide, please. And Also, I would like to say that this presentation are solely my opinion and do not represent the official positions of the Centers for Disease Control. Next slide, please. So as Maureen mentioned, the learn objectives for today's talk is going to be provide you the ability to describe economics and economic evaluation, to understand the value of economic evaluation in public health, and to identify the different types of economic evaluation. Next slide, please. And you can go on to the next one, too. So economics is not about money. Oftentimes people, when they hear that word, they immediately think cost, money, some sort of monetary transaction. But in fact, it is the study of decision, and it measures the service production, delivery of consumption of whatever it is, a project or intervention that you're interested in. And it informs how to choose between alternative options based on available information. So if you're faced with uncertainty and complexity and competing options, say for a public health intervention on teen pregnancy, you use economics to evaluate which option is better compared to another. Next slide, please. Excuse me. And so in that regard, economic evaluation is specifically defined as the systematic appraisal of cost and benefit of projects or interventions normally undertaken to determine the relative economic efficiency of a program. Simply put, economic evaluation is the understanding of and use of economic evaluation of economics and decision making. So for public health, it contributes to evidence-based decision-making by helping the public health community identify, measure, and compare activities' impact. So it helps you identify the impacts of your interventions, of your programs, or whatever it is that you're aiming to do. And it also helps you assess the scalability and sustainability to optimize population health outcomes. Economic evaluation provides you a suite of tools, and that's where toward the end of the conversation is when we're going to look at what those tools are. Next slide, please. So this flow chart that gives you a high-level description of where do you go from basic research to implementation and expansion, and where does economic evaluation play its role. Through the course of going from basic research, which is when you identify and define a public health challenge and assess if prevention is an option, you go to applied research, where you look at whether or not the prevention action would work, and provides information such as what kind of prevention action would work and to what degree would it be effective, what are the important ingredients to its effectiveness or efficacy. And from there, you would conduct some sort of community demonstrations that will inform you on who your target population is and what setting would the prevention work best, and who are your stakeholders, the important people that you need to work with in order for your prevention work to actually be effective. So the applied research and the community demonstration steps are contributors to your effectiveness evidence. So for example, if you're looking at a vaccine intervention, once you finish the community demonstration, that will give you information on which population, what setting is this intervention going to be most effective, and that's your effectiveness evidence. The next step is when you assess how you're going to actually implement that prevention work and how you're possibly going to expand it. And while you do that, you're going to be assessing what resources will be needed for that implementation, how much would it cost, are there some must-have ingredients in order for the implementation to be actually properly implemented, and are there some would-be great ingredients that it'll be great to have them, but they're not necessary, because that will actually that will also contribute to your cost estimation, and as well as your scope and scale of how broader you're going to go, and that information will help you decide on how far into the population you're going to actually expand this down the line in order for it to be sustainable. So the answers to those questions during the implementation expansion process is what provides you the economic evidence, and together for the main ingredients of economic evaluation work. Next slide, please. So in that regard, economic evaluation then allows you to answer what-if questions. They also allow you to answer policy questions, and they allow you to answer production, consumption, and distribution questions. The information you get from economic evaluation would allow you to tell your state leadership or Congress, or depending on how far and broad you're going to go with your intervention. But given this particular sets of parameters, here are the policy implications, and here are the resources needed, including in their cost of how we're going to produce the result of the intervention and how it's going to be consumed and distributed across the population. Next slide, please. So the main ingredients of economic evaluation are your resources and your costs. And your resources include the people, the facilities, the equipment, the supplies required for you to actually implement and push the intervention out. And your costs are all the monetary values of those resources that you use to produce the desired outcome. So the people, facility, equipment, supplies, if some of these don't have an actual monetary value, during your cost estimation process, you turn them into these people, even though they volunteered, for example, would cost X amount of money if we would have paid them, because you need that sort of information to actually produce the outcome that you're looking for. Next slide, please. And another concept that is very important when putting all of this into consideration is your opportunity cost, which is the loss of potential gain or benefit from other options when a particular option is chosen, or the cost of the what would have been, to simply put. And this image shows you two options. One is bigger, the other is a little bit smaller on the arrow. And so part of the decision-making process is, if I go left, I might be using a little less resources and still possibly get the same results, as opposed to if I would have gone right, I would have used more resources and still get the same results. But you don't know that. Once you don't know, like, those would have been, you wouldn't necessarily be able to really tell what they could be once you make your choice. And it's an important aspect of this to try your best to identify, like, what are those potential costs or potential gains that you might have incurred or gained if you chose going right, if that makes sense. Next slide, please. So over the next few slides, we're going to look at how some of these techniques allow us to make decisions in public health or their applications in public health. And as I mentioned before, economic evaluation is an important ingredient of decision making, because it's not sufficient for us to know that something is effective. It's also as important for us to know, yes, if it's effective, so then what is it going to take to actually produce it? Next slide, please. And so, in the words of Dr. Frayden, to establish an effective intervention package, it's critical to understand the full range of available evidence-based strategies, the size and characteristics of a population to be reached, the projected impact of each intervention, and the estimated cost. So that essentially puts what we've just talked about into perspective, that knowing something works is not enough. You also have to know how far wide can you implement it, what is the projected impact of that the broadness of that implementation, and what would be the cost of it. Next slide, please. So this flow chart is showing you, it's another way to look at where all the different kinds of economic evaluation might be useful during your process of developing an intervention or a public health program. For example, when you're at the phase of identifying your problem, in addition to the evidence of how much, say, breast cancer affects women based on prevalence and incidence, you would also need to know what is the societal or the overall economic burden that breast cancer might be putting onto our health system. So that's an example of where economic evaluation is important when you identify a problem. And over the course of a process, there are different places where you would conduct the different kinds. So for example, when you're assessing a program or policy development, you need to conduct a cost analysis to tell you how much money is it going to take for me to develop this particular product. And through the next examples, we're going to kind of see where this plays, and then specifically for the part where we discuss each type of economic evaluation. Next slide, please. So first, for example, we know that 1 in 10 deaths among working age adults ages 20 to 64 is due to excessive alcohol use. And we also know that excessive drinking costs the U.S. $249 billion. So this is an example of demonstrating like a problem identification. You know how much it affects people, and you know what is the cost of that effect overall to the U.S. health system. Next slide, please. This one is, so in the University of Kentucky created an intervention called 1-2-3 PAP video, and the intervention showed that women ages 18 to 26 years old in Appalachian, Kentucky would actually increase their vaccination, HPV vaccination completion rate after watching this video by about 2 times more likely than those who didn't. And to estimate how much that would cost or what it took on, we conducted a cost analysis to look at how much that would cost or what does that mean in terms of economic terms. We found that if the video would have been implemented in the area where it was tested, then and broadly disseminated to all the target population, which is 18 to 26-year-old women, then it would have covered 20 additional women. It would have covered 1,000 additional women with an estimated cost of $389 per series completed. And because it is something that prevents HPV, will ultimately prevent cancer, then making an investment of $389 in an area where it is particularly high in prevalence might be a worthy consideration. And so I'm showing you this to kind of give you that sense of why do you need the cost factor, the economic evidence to help people process the decision a little bit better on whether or not to disseminate and implement something after it's been shown that it's effective. Next slide, please. And this one is an example of a cost analysis for the Prevention Research Centers program. So the Prevention Research Centers are funded by the CDC to conduct some applied public health research in different communities across the country. And what we learned is that for every dollar CDC invests in this program in their project, then the PRCs are able to leverage an additional $8 from other funds to continue on their work. And it's important to know that because then it means that from our perspective, it is worthy of our, of the money that's being put by the program into these research centers to actually do it because they're able to gain on average $8 back to continue doing the work that they do. Next slide, please. So now let's talk about what are the different kinds of economic evaluation. Next slide, please. Maureen sent you a link to a paper and this that discusses economic evaluation and decision-making in public health. So this table is from that paper. It's a quick reference that tells you what kind of process you would like to choose or do depending on the decision level and what you want to get out of it. So for example, a cost of illness is related to disease economic burden, and public health decision makers at the local, state, and national level might be interested in it. Similar to the binge drinking example, knowing that binge drinking costs our economy $249 billion would allow decision makers to assess what to do in their respective level. Next slide, please. So cost of illness, let's talk about it first. It estimates the economic burden of a particular disease. In the case of birth defects, for example, we know that birth defects cost the U.S. system about $2 billion a year. And this doesn't include outpatient care or many provider charges. So then in the long run, overall economically, it would have a higher cost than that. And conducting a cost of illness analysis would lead you to this type of evidence, knowing what is the effect of economic impact of a particular disease, in this case, birth defects. Next slide, please. This example is about program cost analysis. So program cost analysis is a systematic collection of program costs with descriptions of who or what entity incurs the cost. What that means is that it's essentially what we call a micro-costing, where you collect line items of everything that you put into the program or the intervention, and you identify the cost of each of those line items, from your labor to if you traveled somewhere to do your intervention, to the materials that you use to conduct the interventions. And I'm showing you this example from California, where they conducted a family planning demonstration. And what they learned from their program cost analysis is that the demonstration project would have cost a little over $400 million, and in return, it would have been averted the unintended pregnancies that would have been around $1.1 billion in public expenditures within 2 years. And if you, by conducting the assessment of how much does this thing cost, then they can put it up against the cost of whatever it is that they were trying to avert. So it gives you a comparative measure of why and whether or not you should do it. Next slide, please. So this next example is a cost-benefit analysis of state and hospital-funded postpartum intrauterine contraceptions at a university hospital for some recent immigrants to the United States. And cost-benefit analysis is considered the gold standard of economic evaluation, because all the costs and benefits that you get from your intervention or your program, including the consequences and potential health outcomes, are converted to one common metric, which is the dollar. So when everything is put on the same level, you can literally compare apples to apples instead of apples to oranges. As you can imagine, it's difficult to conduct cost-benefit analysis sometimes because it is difficult to implement monetary values on life. And there are many discussions about that, which is beyond the scope of our conversation today in this introductory talk. But when possible, cost-benefit analysis are the gold standard of economic evaluation. And so in this example, for this particular program, they learned that the cost-benefit ratio was $2.94 to $1. And another concept that you're probably used to is return on investment, which is closely resembles because everything is in money terms. So they gained $294 for the dollar that they put in there, and for the state program. And the postpartum IUD program was not cost beneficial, and the hospital actually lost 70 cents per dollar spent on the program. So this shows you that findings from these studies found savings from one group while simultaneously costing another group. And this type of evidence would allow stakeholders in the same process that may be having different considerations. So if you're from the state perspective, then yes, this worked for you. If you're from the hospital perspective, then maybe you wouldn't pursue something that actually costs you money. Next slide, please. So the next one is cost effectiveness analysis, and it compares the cost with natural health outcome units such as life years saved and number of cases averted. This example shows you that expanding contraceptive coverage under ACA is cost effective for Oregon state insurance providers. The proposed policy would prevent an additional 72 pregnancies per 1,000 women and saved $489 per woman enrolled over 5 years. In public health and in health, oftentimes we use cost-effectiveness analysis more than we use cost-benefit analysis because, again, there is challenges in turning life and health outcomes into monetary terms. And it also is more informative to know how many people, if I spend how much money, then how many people are actually affected by it, or how many cases are we going to be averting. So cost effectiveness analysis are one of the most commonly used economic evaluations in public health. Next slide, please. And this last one is on cost utility analysis, which is a special form of a cost effectiveness analysis, but instead of using the per case averted metric, the costs are expressed in a standardized mortality and morbidity measure, which as epidemiologists, you all are more versed in them than I am. But so you're essentially turning both benefits into a QALY or a DALY. QALYs are used more often than DALYs. But so this particular example shows you that the incremental cost per QALY gained by additional 9-valent HPV vaccination was over $146,000 in one model assessment. And in another model assessment, it was $108,000. So why am I showing you this? It's to also share with you that these measures depends on how you create the metrics and like how you assess your costs. So in this one, the results varied considerably when they conducted some sensitivity analysis and uncertainty analysis because of the different ingredients that were put inside of the models. And that's important because, again, specific types of resource would output you particular kinds of results and cost you X amount of money. So when conducting and using some of these tools, always go back to what am I putting into it, how much are they costing, because those are going to be the contributors of your final result of being able to say how much is this actually costing per QALY gained or per life averted or per whatever denominator you're using. Next slide, please. So the last few slides, I wanted to show you these for practical purposes, they're examples of how you might collect data for this type of analysis. Next slide, please. The first one I want to talk to you about is the Public Health Return on Investment template. And the Public Health Return on Investment template was developed by Dr. Glenn Mays at the University of Kentucky. And ASTO has taken it and implemented it, tested it at different state health departments, which you can go to that PHRY template tutorial, and that presentation will walk you through on how some state health departments use it and what are the information that they gained out of it. But essentially, overall, it is a line item identification of what are the things that will take you, that you will need at different phases of a project to produce the outcome that you're looking for. And this one in particular conducts some calculations for you. So you can just put in the information that it's asking for, and it gives you results as you go through the sequence of it. If you want to learn more a little bit about it, he provides some background information on his website and a little bit more about what it is exactly in depth on his website as well. So that's what these links are. Next slide, please. Do you mind going to the next one? They seem to be out of order a little bit, maybe. So we're missing a slide, but that's okay. Yeah, go back to the one before. It's fine. So this is a cost analysis, data collection, screenshots that my program uses. Maureen mentioned before that I was a graduate of a PE fellowship program at CDC, which is the Economics and Decision Science Fellowship for CDC. And one of my jobs when I was a PE fellow was to create a cost analysis tool for the PRC program, and this is one of the results of them. The slide that's missing is, it's okay that it's not there. We'll make sure that you get them later. But the other slide shows an Excel file that pretty much captures the same exact information as this particular tool does, but it's a simpler version of it in the fact that if you were today wanting to conduct a cost analysis of your program or an intervention in your group, you can easily do that by creating an Excel file categorized based on the different categories, such as your labors, your materials, these items on the left side of your screen, and create line item recordings of how many people did you take, what kind of people, and how much did each of those people cost. So looking at this particular screenshot, we turn that Excel file that we began with into this module, which is now included in our whole evaluation reporting system. And we have a really great developer, so we know that we're a little bit privileged in that manner. But essentially, our developer turned the Excel file into something where people can input the information either by line items or in a form format like what you see. And this example that you're seeing here tells you that a given PRC paid consultants for a year during their pre-implementation phase, and the money came straight from the PRC dollars that CDC provided them. And the cost of that whole entire consultant action or investment was $40,000 a year. And in the note, they identified that 5 consultants worked at a total of 200 hours to result in a total cost of $40,000 a year. So again, you can get this same information on a simple Excel table, or you can create a module that is a little bit more refined in the sense that you can have form formats. And one of the reasons why we also we have this module in this current version is because one of the lacking things in public health is connecting effectiveness evidence or impact evidence with economic evidence. And my group decided that we're going to have one system that collects and reports evaluation data, including cost of the core research projects of the PRCs, all in one place, so that you can readily look at what did you do, is it effective, or what's its impact, and how much does it cost to make things easier. But this concludes the talk part of my presentation, and we can open it up to questions now.
Okay, so thank you so much, Kristina. I think the way that we'll do this is as people have questions, if you would press *7 to unmute your phone, and then go ahead and ask a question. And when the two of you have completed your conversation, then press *6 to mute your individual phone lines again. So feel free to ask questions at this time. And if that's complicated, I can unmute all of the phone lines as well.
Before we begin, Maureen, do you mind going to the next slide so that I can see my email information? I also meant to say that feel free to email me if you have any questions later, or if you want to learn more a little bit about some of the resources we shared today, because I understand like you might have further questions later after the talk. And I'm happy to email you as well an example Excel file if you're interested in that. But just send me an email at Rabarison@cdc.gov, and we'll go from there. Thank you.
And I'm going to go ahead and unmute everyone just for a moment so that people can, if there are questions. So if you're having a conversation or typing, please stop. Here we go, unmuting everyone.
The conference has been unmuted.
So feel free to ask questions. Do we have any questions?
Hi, can you hear me?
Yes. Mm-hmm.
Oh, okay. I was trying to unmute myself a couple of times, but so thanks, Kristina, for your presentation. I just had a question about one of your slides where you talked about, I think you talked about CBA being a gold standard, and one of the examples was about the cost-benefit ratio, and I wonder if you can go back to that slide on this presentation, and it said like $2.94 to $1, and it just wasn't clear to me how the two sentences connected, because then you said that for every dollar spent, or for every dollar spent, it was you gained 70 cents. So anyway, if you could just go back to that slide and maybe explain
my
that.
apologies. I must have misspoken. Yeah, can you go back to that slide?
Was it this one? Yeah, I think it's the one after this. Yeah, this was, so state-financed IUD program.
Okay.
294. Yeah, that one. Thank you.
Okay, so, no, sure, thank you. So the cost-benefit ratio from the perspective of a state finance program is $2.94 for every dollar. And where the 70 cents comes into place is that from the hospital's perspective, instead of gaining $2.94 for a dollar, they actually lost 70 cents per dollar spent on the program. So I should have put them in and that's my apologies, I should have put them in the same format instead of writing it out in the sentence for the next one. But essentially, the cost-benefit ratio from the hospital perspective was 0.70 per dollar, where it's a loss, not a gain. Does that make sense?
Yeah, so I guess it would be cost, if you're saying cost-benefit ratio, this would be 295 by 1, and then for the hospital it would be 0.7 by 1?
Right, but it's
or
a cost.
Okay.
It's like a negative 70 cents by 1 as opposed to a positive 70 cents by 1. So they lost $70 for every dollar that they spent instead of gaining $70. Excuse me, they lost 70 cents for every dollar that they spent rather than gaining 70 cents for every dollar that they spent from the hospital's perspective.
Okay, that makes sense. And I had a quick second general question too, if that's okay.
Yeah, sure.
And that was, so you talked about how input, some of the inputs we need to calculate some of these to do some of these economic analyses has to do with just how much it costs us. But how do you assign how do you develop data sources or develop data for like calculating what is the benefit of interventions, things like that? So how do you extrapolate those numbers? I get how you extrapolate the cost, but in terms of benefit, what is typically used?
And so that's where, like, it's way beyond a 5-minute conversation, but that's where, for example, doing cost-benefit analysis is really challenging because there are different people who value human life in terms of money at different thresholds. And in the United States, we actually refrain a lot from doing that. I think there's like a PCORI group that decided that we're not going to do that. Like, it's attached to the ACA and everything. So we can have a conversation about it offline, and I can refer you to some papers, but the short answer is that there are different estimation thresholds of how much a human life costs, and that's how you replace it. And you conduct like a lifetime assessment of if this particular person has this particular disease, how long would they be living? And given that length of time, then how much would it then be worth? And that's like a very uncomfortable thing to say about human life. But in terms of cost effectiveness analysis, it is you turn the you use QALYs, which is acceptable, right? So part of your effectiveness analysis is you're identifying what is the QALY gain or loss of a particular intervention, and I believe epidemiologists do that often. I'm not well versed in it, but you get a QALY measure, and then you compare that QALY to the cost to get your effectiveness in terms of money. But that's what makes CBAs are great. They are considered gold standards because everything is in terms of one unit, same metric, aka dollars, but they're challenging because of evaluation of life varies greatly and oftentimes is not something that we usually necessarily do.
Okay, thank you.
Another way that people replace that cost is, say, for example, they use the burden of the illness and assess that based on how many people they're intending to scope it out at. So if something is going to cost $2 billion overall, how many people are they intending to get like the per person cost of that, and then use that information in the CBA. But again, if you want to talk about it a little bit more, we can talk about it later.
Okay, thank you. No, that's useful to hear because, from what you've described, I think the cost-effective analysis is what is most relevant and also actionable.
Right, and for public health in particular, some public health professionals might not really be used to seeing QALYs, for example. So for public health, if you can give a decision maker, this is going to cost X amount of dollar per person, that is probably the best thing that you could do, because then you don't have to explain to that policymaker what a QALY means, what a QALY means, because they'll be able to say, oh, this is going to cost me $5 per person. That's a very easy evidence to make decisions on. Maybe not easy, but easier to make decisions on. But that's a good question. It's a really great question.
Kristina, this is Kristen Rankin. Thanks for your talk. I appreciate it. I was just going to say, I think, I think it's all kind of about the perspective, right, too. So I'd love to hear you just talk about, because I know that a lot of the APIs and health departments are getting requests for, return on investment being very short-term to one payer, and how it would be great if you could just talk a little bit about that versus cost-effectiveness analysis for public health prevention efforts.
Okay, sure. Thank you. That's a really good point. And that's one of the reasons why I shared with you guys that ROI template, because, yes, there are a lot of efforts that ask state health departments, et cetera, into producing short-term, and Kristen is right. And you're welcome, Kristen. It's my pleasure to present for y'all. Kristen is right in the fact that the perspectives matter. And so in your case, knowing how much your program costs is probably more important than knowing how much it really costs in a big scope of things later on. And so the analysis that you might want to do are program cost analysis, which is, again, you can set that up on an Excel table and create line items of how much each thing that you use to do a program is, and your denominator would be the numbers of participants that you had for that specific program or that specific intervention, and you will be able to say, this program costs X amount of dollars for this amount of people, and you can do that on a very short term with the understanding that it is in this perspective for this particular program, and further analysis can be done later into looking at the societal perspective or whoever the payer is. So one of the reasons why the PRC program decided to ask our grantees to do a cost analysis is very much so because of this point that Kristen is making, where we're not expecting them to do CEAs or CBAs. What we want to know is how much of the money that we're putting in a particular PRC for research projects is actually going to cost for the people that it's going to cover. So that's why we're encouraging them to do a cost analysis instead of a more complex analysis. And you can do that very simply just by using an Excel file. And I'm happy to share an example Excel file if you would like to, but the ROI template, if you go to the links that I shared with you and look at the example from ASTO, it'll really help you see what does this do, and it'll give you the ROI that everybody probably is starting to ask you for. And it takes a little bit of setup, but of course, because you do have to take into considerations of all the inputs that you're putting into it. But once you get it set up, that particular template does all the calculations for you. And one thing, so in our case, we use salaries and percent FTEs, for example, to estimate people. The best scenario is to do time logs of times that people spend to do a particular activity as part of your program or your intervention. But know that that's not necessarily a limitation, because that's actually time consuming to have people do that. And if it's not easy for you to do that, then use replacements, how much percent FTE is attributed to X activity. But thank you, Kristen. That was a really good point.
Other questions? All right. If there are no other questions, then thank you so much, Kristina. I really appreciate this wonderful presentation. We'll look forward to sharing your slides once they're through the clearance process. I want to remind all of our participants that you'll be getting an email with a link to a survey for this call. We really appreciate your participating in that survey and help us evaluate the call. Just a reminder, the next webinar is Introduction to Trend Analysis, Wednesday, October 26th. Same day, same time. If If you have any questions, feel free to contact me, Maureen Fitzgerald at CityMatCH. Everyone, have a great day, and thank you all again.
Thanks, everybody. Bye-bye.